Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, so today I'm in Los Angeles, California, and we're at the HealthSpan Summit 2025 put on by Elias and his team. Let me tell you, huge conference. If you haven't been to one before, you better be here next year. My second year in a row coming, and I will be coming back next year. My next guest is Gaurav. Gaurav, welcome to the show.
Thank you for inviting me, and thank you for being here.
All right, so HealthSpan Summit, man. Tell me, so far, how has your experience been? This is day 2.
Yeah, it's been an amazing experience. In HealthSpan Summit, we have learned so much about longevity that I can't even imagine the type of speakers that are here. And Elias has put on a great show to get the right set of people. And it's a single place where if you're a good startup or you're a bigger company, it doesn't matter. I think to come to the same place and to present to the like-minded people, to be there and understand that the mission is to live longer, but quality care and quality life. It's just amazing.
So what brought you out here originally? What brought you here today?
So I'm here because I have my startup. I'm a serial entrepreneur. This is my 5th startup. I've done 4 successful ones. Shoot me because it's like I'm coming back to
4 successful ones.
And then after that, I'm going back to building one. So Nick was saying something yesterday when he introduced me on the stage. He said that serial entrepreneur Gaurav Kohli, doing his 5th one, that means this is bigger than previous ones. He's absolutely right. It's basically, it's in healthcare. And it actually helps longevity.
Real quick, before we go into that, were your previous startups, were they also in healthcare? Or is this
Very good question, Adam. No, the previous startups were actually in transportation. So if you think about Fox Rent a Car at the airport, I was the chief product technology officer of Fox Rent a Car, where I sold my 4th startup to them.
Wow.
That got sold to Europe Car, where I was a chief product technology officer for $3.6 billion company, right?
Wow.
And so it's basically being part of that area, running corporate companies, building small companies and selling it out. This is, the first one, healthcare.
Wow. And so go further into what you're doing today.
So what basically I've built and my co-founder has built together is a company which we are here in the HealthSpan Summit is VitalFriend. The name is very simple. It's your vital and friend. So it's we always say we are a friend to your vitals. So there's a big problem in America. As you know, 80 million people as seniors that are huge in America, the population. So we have actually taken the problem and attacking it to the root and trying to provide better quality care for those seniors to know exactly how's your dad doing, your mom is doing real time. How do you know that? Taking consumer wearables and making them into medically grade equipments and wearables with very high adherence and very high wearing capacity. So we came up with a product which is Buddy, which is what I'm wearing. And we all wear it in our company. And the Buddy basically does continuous remote patient monitoring, collecting data, 1,440 data points per biomarker every single day. And it takes all that data to our AI and analyzes data, provides it back to the doctor. So peace of mind for your loved one. Physicians are happy because they get no one-time data. It's continuous data, so you get a stream of trends knowing. And then the facilities where the seniors are retiring, they are more ordained to knowing how the facility prevention care is provided. And our goal is to provide preventative and personalized care to the senior, which is missing. And that, I believe, is the way to do longevity with quality.
How did you come up with that idea originally? Like, where'd that start? Because obviously with multiple startups under your belt, like there's no shortage of ideas. There's no shortage of things you can spend your time on. How did you know, well, first off, how'd the idea come about? And how did you know this was going to be something that you sink your teeth into?
That is a very good question, Adam. Once, like any other idea, when my previous one came in, I implemented...
Whenever I hear an idea, I say, no, don't talk to me. Go the other way. I don't want no part of it. Don't sign me up. You got an idea, you keep it to yourself unless you're on the show. Go ahead.
Think about, let's say, in 2011, I had just finished my first startup, and I'm going back and then coming back to your question in a minute. And I was actually just, bought a brand new car and had a home, family, and I was back in India just traveling because my startup was doing really good, the first one in transportation. And I was just sitting and I was like, I just bought my brand new car. Where do I rent my cars? So I was the first person in the world who started Just Share It, which was the first Airbnb for cars.
Wow.
Then Turo came in, then other people came in, we did it. And then I sold that company to Fox Rent a Car. And it's all public information, LinkedIn information. So when you said, you're exactly right. How does idea come? Because idea is everywhere. So how did this one come in? A couple of years ago, my dad fell. And basically, my mom went to open heart surgery, and they're in overseas. And so when they're overseas, they're like, never want to tell you things.
No,
so
of
my
course
mom
not.
and dad
Yeah,
are healthy. That's good now. But me and my brother are always worrying. So I was like, there got to be a way to know how they're doing.
Like actually, and them not lie to you and tell, because not lie in a bad way, but they want to keep things from their children. They don't want to worry you. They don't want to worry you. My mother, when she was around, she was the same way. So she was like, go ahead, continue.
So when that happened.
Dang, so hold on. This is the opposite of like the older generation would have been like, or last generation, like baby monitors, or how do we spy on our kids? How do we put trackers on them? You were putting a tracker on your dang parents, Squaw. What the heck?
You got it. So now you know exactly. So I was putting the Buddy, we call it Buddy, which is Biometric Unified Data Delivery Interface.
Oh, this
it's
is
a mouthful,
great.
but it's Buddy, B-U-D-D-I. And so I decided, how do you make a buddy being in their lifestyle, put something there? So I looked at it and I said, wait, everybody's wearing wearables. Wearables is everywhere. So I said, that's easy for me. I don't need to worry about wearable, but I need to give them a medically grade wearable. So this is the FDA-Cleared already wearable that collects BP, which is FDA-Cleared, and heart rate FDA-Cleared. So it will be able to take that data and many more other biomarkers and collect all that data and then able to say it to us and do all the analysis. So I get my daily summary report about how they're doing.
About your parents. Oh my gosh.
So then I looked at this issue. I talked to multiple people and then I found, oh my God, in America, this was just overseas how the idea came.
Yeah.
And when I looked at America, I was like 80 million people, 12,000 seniors are becoming, or people are becoming 65, 12,000 per day in America.
Wow.
So when I look at that and I was like, oh my God. And then I talked to a couple of people, same problem. Say they don't know how the health of their parents are, what they're doing. Is the facility providing the better preventative care, personalized care or not? And all that me and my co-founder sat together. He's from health tech. And so I was like, let's build something which is better for the seniors. So we're making a huge impact. The mission is that every senior is going to wear a Buddy one day.
Wow.
We will be able to get that information. And the kids and the facilities and the physician will provide personalized care. The key thing is personalized care.
Yeah.
When you get up in the morning and your temperature is high, that doesn't mean that you're sick. It's just the body takes the time to come back to normal at a certain moment. So why do you go for a walk early morning? Maybe you should go for a walk at 10 a.m. because it settles down. Buddy can tell you that. And that's the difference where Buddy makes a big difference. We are the only ones who actually do a deep sleep blood pressure monitor, which is the most stable and the most calmest as the body can do. And so how do you know any wearable that's doing that, which is on the deep sleep side? So there's a lot of stuff and studies that we are into now.
Wow. What did your parents say? This gotta be funny. They're like, what, you doing all this to put a tracker to monitor me? What'd they say?
So my parents basically actually in the beginning were like, really, how it is, will I be wearing it and all this stuff. But once they started wearing it and they saw the data, what's coming out of it, and some of the features where we have built in terms of providing care and quality care and connectivity, because now they feel they're connected with me and my brother because they have a buddy all the time. Right? And the buddy speaks to them. Right?
Yeah.
And that's the best part. It tells you, hi, Mom, how's your health today?
Stop.
Which, I'm not kidding. And that's why it makes it where the connection is where I'm so busy in my lifestyle running around that I have to build something in my lifestyle for them and they have to have something on their lifestyle for what they were going to adapt. So in the beginning, they were like, they're not going to wear it in the night when they sleep. Once they saw the value and just saw the data coming out, they were like, really good. So that's where it is.
And then they see it and they're like, they don't want to go to sleep without it on because they want to know what their numbers are too.
Yes. And it's the most comfortable, lightweight, consumer, medically grade wearable. So yes. So that's a very good question.
What are your plans for this going forward?
First, we've just started 4 months ago. It's the traction has been amazing. We are actually into multiple ALF, which is assisted living facility, and senior skilled nursing facilities. We're also working with concierge physicians. And the goal is to actually have a buddy in everybody's home in America. That's one. But also, I think the education is very important. Whenever I meet any conference, anywhere I go to, the first question people say when you look at this thing, is it a watch?
Yeah.
And I say, no. It's more than a watch. It's your buddy. And that's the difference where a lot of the things, and it's FDA cleared, which is very critical in terms of believing the data.
So where do you see this in the market? A lot of different wearables. How do you position this? Like, what's your positioning in this that makes it, I know some of the tech makes it obviously unique in what you're doing, but how do you get into that? Like you said, there's a lot of wearables out there.
You're absolutely right. There are wearables from $25 to $200 or $300 or $400 also, right? And how do you make a decision? What is the thing? And this is where we are very unique. As we are FDA cleared and basically it's a wearable, and it is a BP monitor that is FDA cleared.
Yeah.
We are going with the space to the facilities, which is the retirement facilities and the concierge physicians, and we are going with a program in the insurance that is known as remote patient monitoring, RPM. And so utilizing that, because RPM has strict requirements for providing only a FDA cleared or FDA approved device.
Interesting.
So that piece of it is what we are going with and saying this is the way to position us, because we're going to be focused. So I always say we want to be safe, we want to be secure, and we want to be 100% compliant to Medicare and to basically insurance.
Yeah.
So that's the platform. So it's a continuous monitoring platform for seniors. That's what we have built.
And that would be, correct me if I'm off, that would be kind of like the B2B side of things.
That's exactly right. It's
and
a
then
B2B side. I'm not selling to B2C. So the main thing, the positioning is, it's not a B2C. I have so many people come to me, even in this conference, saying, can I buy it? Right? Can I take the buddy? I said, no, we do not sell buddies.
Oh, so you're not going to go B2C at all currently, or maybe in the future?
Today, our goal is B2B.
I understand.
It's a big enough market, and it's making a high impact on the seniors.
Yeah.
That I don't want to just dilute and go to a B2C. There's multiple other companies who's doing a B2C on wearables, and I'm okay with that, right? But for us, the B2B market and making it easy, comfortable, data quality of data, wearing adherence. We have a 20 hours wearing adherence, more than any other wearable right now that the seniors wear. We have a 99-year-old wearing it to a 104-year-old wearing it. We basically have people wearing with dementia, Alzheimer, autism, you name it. And that's where it makes it so unique. And you cannot put anybody's device onto their wearable on their hand, because it has to be FDA cleared. It has to basically have the Medicare approved. There are lots of things compliant. So I always say we want to be safe, secure, and compliant all the time as a company, because we believe that that's the right way to come out in the market and position yourself.
Amazing. Well, Gaurav, this has been amazing having you on the show today. Last thing I want you to do, look into the camera. If somebody wants to learn more or to follow up, how do they do that?
So if you guys want to get in touch with me, you can go to VitalFriend.com, VitalFriend.com. And you can reach me personally if you like. It's Gaurav, Gaurav, at VitalFriend.com. Happy to answer any questions. Thank you.
Fantastic. And for everybody watching at home, just so you know, we'll definitely put some links in the show notes, so you can just click on the links and head right on over. And speaking of the audience, if this is your first time with Mission Matters and you haven't done it yet, hit that subscribe or follow button. This is a daily show. Each and every day, we're bringing you new content, new ideas, and hopefully new inspiration to help you along the way in your journey as well. So again, hit that subscribe or follow button. And Gaurav, man, appreciate you coming out. Thank you so much,
Adam.